general preview was
All right. Welcome, everyone. Can you hear me okay?
Okay.
If you can find your seats, we'll just get started here. So welcome. Thank you so much for being here this afternoon. My name is Aaron Troisi. I'm the political director with SEIU Healthcare Pennsylvania. We're the largest hospital and healthcare workers union in the state, and we represent the workers at Regional Hospital and Moses Taylor Hospital. Important to name both of those things because in the news, as people are talking about the potential closure of Regional or this deal with Woodbridge sort of falling through and trying to negotiate a new deal or a new owner here, we often forget, or some people often forget, that when we talk about Regional, we're talking about all of the facilities and services at Regional Hospital and Moses Taylor Hospital as well, right? Because they are now merged under a single license. And so when we talk about the potential closure of Regional, and we talk about the importance of saving Regional Hospital, we know in this room we're talking about all of those critical services that provide so much care to the families in our region. I wanted to get a sense of who's in the room with us tonight, just quickly. I wanted to shout out a couple of the organizations I saw as you were coming in. I'm sure I'm missing some. We have folks from the Maternal and Family Health Services. Thank you for being here. From Put People First, I see you there. From Action Together, where are my Action Together people? Hello, welcome. Okay. If you work at Regional Hospital or Moses Taylor, raise your hand, give us a hello, welcome. Thank you. Thank you for sticking through it. Despite the madness of this moment and the rumors that are always flying around, I know it is challenging. And we were here, I know many of you were here with us back in December, and we were hopeful that we would get an update, by the first of the year, or by February 1st, or by March 1st, right? And so I know there's a lot of frustration among the folks, especially who work there, but also in the community about what's happening. So I'm excited that tonight we will get an update from our state representatives who have been involved in that process. But I also wanted to, thought it was important for this town hall to not wait until we have a deal. And the reason for that is we've actually been through this. As you may know, hospital consolidation, sales, mergers, and acquisitions is happening more and more across the Commonwealth every day. And in our experience, that process really happens in sort of two different phases. The first phase is saving the hospital, keeping the hospital open. But the second phase is making sure that whoever takes over is providing the best possible care to the families in that area and is being responsive to patient needs, to frontline staff needs, and to the family and community needs in the community that they serve. And so in addition to hearing from our panel this evening, we're also excited to be launching a broader coalition to protect care and jobs at Regional, and we hope you all will join us in that work. And so this town hall is both a town hall to discuss what's going on, but also we are going to get to work. And we're going to invite all of you to join us in that in just a little bit. And so without further ado, I wanted to pass it over to our state representatives to start with an update. Then we'll hear from our prepared speakers this evening. We'll talk about some important next steps we're going to take together. And then we'll open it up if you have questions or if there's more discussion. We'll have plenty of time at the end for that. I just want to remind us, I think everyone in this room, I think we are united in our mission to save Regional Hospital. And we should be clear that when we're talking about saving Regional Hospital, we're not just talking about the brick and mortar buildings there. What we are talking about is the incredible amount of vital care and services that are provided day in and day out by every single nurse and CNA and lab tech and everybody else who works at the hospital and all the services they provide to families in this region. And we know that whoever the next owner is going to be, we have to stand united to make sure that they are going to provide improved care in our communities and invest in care, that they're going to respect our union contract and the workers who actually work at the hospital, and most importantly, that they are accountable to the patients and families moving forward. So thank you again for being here tonight, and I'll pass it over to State Representative and registered nurse, Bridget Kosierowski.
Thank you.
Thank you, Aaron. And I'm always running late, so I see my friend Boris over here, and he did text me and say, 5 minutes, I'm on my way, so I'm giving him a minute to kind of get himself set up there. Okay, frustration, rumors, stress. Bob Bolus in the front row here. This is going to be a great night, right? I know. That is the main thing, is our results. So again, I'm Bridget. Thank you, Aaron, very much for organizing and starting with us. And I feel a little bit of deja vu. We were here in December, and we were very hopeful by now we would be able to have an announcement about where our future is with regional. I do know, and I am very confident to say that we are going to keep this hospital open. These doors will remain open because the service lines that are provided and the staff that provides those service lines, specifically OBGYN, cardiac, and emergency room, are vital to this community, and it would be catastrophic if they were to be taken away, because that patient population would have a really hard time traveling. If you're in active labor, if you need an emergency room, you can't travel far, right? And a lot of these services are not provided at the level that they're provided at regional at our 2 other hospitals that here in Lackawanna County. So that message and that stress and that urgency is with the highest level working on this. So know that. But it's really hard to come together tonight again, right? And say, we're still working on it, hang in there. But I'm telling you this message from the bottom of my heart and from what I do believe, and I have been assured that we are going to keep this place open, and there are actively people working on this. When I talk about this hospital and I talk about the services provided in this, it's our best playing card, really. Because when you talk about OBGYN, you talk about the NICU, the level 2 NICU, sick babies, moms in labor, emergency room services, there is no doubt that the 2 hospital systems here, Geisinger and Lehigh Valley, they are also as desperate as you are to make sure that place stays open. Because we all know the waiting time in those hospitals now is at a high level. They're overrun, they're stressed, their workforce is stressed. So for them to have to entertain the possibility of regional closing is just as frightening and stressful for them as it is for you all here in this room. We are really fortunate because I know there's lots of news in the Commonwealth about other hospital systems that are failing. There's lots of reasons for that, but I will tell you that our hospital here is in a unique situation because of the service lines that are provided and the strong generational workforce that's there, and the true outcry of the community and the partnerships we have in our community to continue to help keep this place open, whether it be private sector, whether it be our wonderful foundations, whether it be the folks here with me, to my left here, my state representative Kyle Mullins and I, and state representative Kyle Dunny, who was out of town. He has Sean here with him, Sean O'Shea from his office, his chief of staff. Hi, Jimmy Haddock. Jimmy Haddock just walked in, another state representative who's, tirelessly following the leadership of Nurse Bridget on this. But we do have great partners. So know that, as much as sometimes silence and no updates and information can really create stress, and the unknown is not a good place to have to go to work in every day, and we know that. But just please, from what's happening here tonight and who you're hearing from tonight, because the people on this table with me, they're the ones that are actually working in those doors every day. They're taking care of our patients, and a lot of our patients, are people that we grew up with. And when I talk about the uniqueness of Regional Hospital and the uniqueness of Scranton, really, a lot of us grew up here. I'm a daughter of a physician who practiced here for 42 years. He started the trauma center up at CMC Hospital in 1974 when he moved back to town. He took care of lots of patients. I'm looking at Bob Bolus. Your brother was a physician here for many years. I'm looking at my friend Jeannie. Her husband is a physician here in town. Chris Shermack, you worked with EMT and transported tons of patients down the road. We have the Wright Center here with Dr. Linda Thomas. We're really fortunate that we have this kind of commitment here in this room again. They were all here in December, and they're back tonight. That helps us tremendously when these negotiations are happening. But I'm going to close with the fact that I want to make sure that message is clear that we will not close these doors. We cannot let that happen. It'd be catastrophic to our community and catastrophic to our patients. Now in my new role, I'm supposed to call everybody my constituents, but I refer to them as patients all the time because that's what I did for most of my professional career, was take care of people and take care of patients. So a lot of times I'll say, I have a meeting with my patients, but I think we all believe that, because this group up here with you is really committed to making sure that we keep these doors open. But I know it's frustrating, and I know there's a lot of stress, and I know there's an enormous amount of rumors. I mean, today my phone was, this one, we're getting an announcement tomorrow, they're closing. This one's happening. So it's hard to keep focused when that's what's in your ear all the time. But I'm going to let Representative Mullins kind of say a few words now, but I just want you to know that you have a team here that's truly committed, and back in Harrisburg, truly committed to making sure these doors stay open.
I want to thank my colleague and friend, Representative Nurse Kosierowski. So I always like to keep a nurse nearby. But our friendship and partnership on this one is real, along with those officials who Bridget mentioned, Representative Donahue, Representative Jimmy Haddock, Senator Marty Flynn, Senator Rosemary Brown, commissioners here in the county. Look, you all got into this business to help people. That's why else would you follow a calling to go into healthcare? You got into it expecting the unexpected. But what you shouldn't have to expect or wonder is if your place of work will be open in the near term or the intermediate term. Right? We got into a line of work where we get hired or fired every 2 years. It's an occupational hazard. But you all got into a line of work of helping people on some of their worst days and some of their best days. But what you don't deserve in that is the instability and the uncertainty and questions that have only grown, and I'm sure exacerbated your anxiety. So for that, I'm sympathetic to you, and I'm sorry that that's what you're going through, you and your families, and your patients, and your patients' families. But to the extent that you can trust us, and that you're willing to, I'm sitting here telling you that leadership at the highest levels of our state government are working to ensure that these doors of Regional Hospital will not close. There are multiple nonprofit, reputable operators at the table, and I'm looking all of you square in the eye and telling you I don't know who they are. We are not privy to that and are not at this point in the process, because there are non-disclosures and things involved. We cannot be privy to that. Representative Kosierowski is not privy to it, nor myself or any other legislators here. However, we have been reassured in weekly, sometimes multiple times a week, calls and meetings and conversations with the governor's office and the foundations, our wonderful community nonprofit foundations, that these doors will remain open, and that the current operator and prospective operators are negotiating in good faith. And however fragile of conversations and processes that we've seen play out over the last few months and weeks, we are confident and we remain hopeful. And I know the question going through your mind is, Kyle, Bridget, that all sounds great, and I'm glad you're hopeful. I understand that. You're allowed to think that and feel that. And I won't tell you you're not. But I'm telling you the information we are being given by trusted individuals working day in and day out to make sure this situation doesn't end up like a Crozier situation, if you heard about that in southeastern Pennsylvania. We are fortunately not on that path. And barring some unforeseen event, that will not happen, and I keep saying it, these doors will remain open. To demonstrate the Commonwealth and from the legislature's side of things, our commitment and energy and focus on this, we secured emergency funding for a facilities assessment, which is very much nothing we've, again, been able to see or review. However, the systems, the prospective operators are in receipt of that in order for them to evaluate just what is needed at these facilities, a look under the hood, which is something that was desperately needed to make sure these conversations and negotiations continue to move forward. And it's my understanding that it's only roughly 3 weeks ago that they were able to get this assessment in hand. So I know it seems like no progress has been made and that we're here a couple months later telling you to be hopeful, sitting at the same exact table, telling you to have faith for something that's very hard to trust and continue doing your job day in and day out with good faith, with this possibility hanging over you. But I'm here to square with you, and everything I'm telling you is what I have, the information that I have the benefit of. And there are really, really good people in all parts of this conversation trying mightily to bring this to a resolution that makes sure the doors not only remain open, but that there is a promising future for patients, most importantly, and for you all to walk back into work with some renewed confidence, that confidence I talked about at the beginning of going to work, expecting the unexpected to happen that day, because that's healthcare. But you don't deserve for the unexpected, for one of those things, one of the unexpected elements of your day to be, will my job and my hospital be here tomorrow? So I thank you for giving me that time.
Thank you, Representative Mullins, Representative Kosierowski. If you have questions for the representatives, please hold those for a moment. We're going to do questions sort of at the end. We'd like to hear from our panel of speakers. First, we're going to hear from Sue Higgins, who is a medical technologist in the lab at Regional Hospital. Sue?
Good afternoon, everyone. My name is Susan Higgins, and I've worked at Regional Hospital now for 6 years as a laboratory technologist. I want to thank everyone for joining us today to talk about a subject near and dear to all of our hearts. We are here to support state leaders in getting a deal done that will save Regional Hospital, and also to discuss how we will work with the new owners once a sale takes place to ensure the highest quality of care. As State Representatives Kosierowski and Mullins just shared, we're hopeful that a deal will get done soon, because a deal must get done. Regional Hospital is too important to our community for us to let it fail. Regional has over 36,000 emergency room visits and over 381,000 total visits, patient visits each year. If the hospital closed or cut services, surrounding facilities would not be able to absorb these patients. We'd end up with even longer wait times in Northeast Pennsylvania emergency rooms and a severe shortage of beds for patients who need them. Regional delivers over 1,700 babies a year, 70% of the births in Lackawanna County. Regional also has the only level 3 intensive care unit for newborns in the county. The next closest neonatal intensive care unit is a 45-minute drive away, and when it comes to critical care, every single minute matters. Regional must be saved to meet our community's healthcare needs and also for the huge economic impact that it has. That's why we're here today. It's why we're taking action. Recently, over 1,400 community members signed on to a petition to elected officials calling for state support, which we also ran as a double-page ad in the Scranton Times-Tribune. We're proud that so many members of our community are getting involved, but we also understand that the real work is just beginning. Those of us on the inside of the hospital know that saving it requires more than just keeping the lights on. The truth is, we've lost a lot of our staff due to the uncertainty of what is going to happen, and it is easy to understand why. When you have young children at home, need insurance, have bills to pay, it's tough to just wait and see. Right now, we're overwhelmed with the number of patients that we see in our emergency room. I know nurses who are working double shifts throughout the hospital because they just don't have enough staff. These challenges affect our ability to recruit and retain new healthcare workers, but they also affect the care that we can provide our community. So yes, we come together to save this hospital, but we gather to do more than that. Today we are launching our Coalition to Protect Regional Care and Jobs. That's why we've asked this panel of speakers to join us today to touch on their perspectives on improving care, the importance of good union jobs, and the need for the new owner to be responsive and accountable to our community. So now I want to pass it over to Alan Lucas, a local firefighter, EMT, and the president of the International Association of Firefighters, Local 60. Alan, the floor is yours.
Thank you, Sue.
You're welcome.
Again, my name is Alan Lucas, and I'm happy to be here with you this afternoon. As an EMT and firefighters, we're often the first people to respond to a scene, and I can tell you from firsthand experience that we need regional hospital. In Scranton, we have a proud union fire department, and I'm the president of the local union, the International Association of Firefighters Local 60. Our job is to help people in times of need, whether it's arriving at the scene of a fire, a car accident, or any other emergency. We're here to serve our community and provide quality care, much like the nurses do in our hospitals. It's distressing when some of the pillars of health care in our community reaches the brink of closure. We work hard to provide quality care in the field, and we know the importance of where our patients go after that. We want to know that our hospitals are going to be able to take them and that our patients will have a bed waiting for them when they arrive. It seems simple enough, but it's not always the case. Our other hospitals are already slammed, and they can't take all the regional patients as well. We want to know that our hospitals are going to be able to provide and have a bed for our patients when they get there. Sometimes we have multiple hospitals on diversion status at the same time. It's already a growing problem, so what do you think is going to happen if regional closes? The situation isn't good now, but it's going to get a million times worse if that occurs. The other point I want to make is that this issue is personal for Local 60. As firefighters, we put ourselves in harm's way a lot. And so saving regional matters to the people we help, but it also matters to our fellow firefighters if they're injured in the line of duty. In the last year alone, regional hospitals saved the lives of 2 of our members. Both of them are still up, speaking and serving our community today as firefighters due to the care they received at regional. So yes, the next time one of my guys has a medical emergency, I want the same outcome for them too. I want them to have a chance to get the best care possible, and that means we need all of our hospitals open. I'm proud to be part of this push to ensure quality care and good union jobs and to make sure that regional will continue to be accountable to our communities under new ownership. I look forward to welcoming a new owner and to work with them to raise healthcare and job standards in Scranton, Pennsylvania, and all the rest of the Northeast. Thank you.
Thank you, Alan. Next, we'd like to hear from Emma Mangel, who's a registered nurse in the ICU at Regional Hospital. Emma?
Hi, my name is Emma Mangel. I've worked at Regional Hospital for the past 2.5 years. I'm happy to be here with you again today. When I spoke at the last town hall, I made something very clear. This hospital and the employees who work here are Scranton. We are what embodies the spirit of this community, and I want to make sure that I reiterate this again. This hospital is a necessity to the community and the people who reside here. They depend on us. The surrounding hospitals do not have the capacity to take our patient load on top of their own. I became a nurse to protect and care for people. Being a nurse in my union allowed me to grow my voice and be a better advocate. When we are united, we have the ability to stand up for what's right and truly stand up for everyone's best intentions. I also know that there is a direct link between healthcare workers who belong to a union and quality care. Looking ahead to the future of the hospital, I know that we need to maintain and expand our union jobs. As a result of the sale that fell through, we have faced bare bone staffing, we have skeleton crews providing care, and that needs to change. I know that this hospital is one of the most important economic drivers in this city. We have more than 1,000 jobs at the hospital. That's $148 million in wages and benefits that go to local working families. The jobs we have to maintain, as well as the jobs we look forward to having in our union, will ultimately raise the bar for the care we provide now. Raising standards and delivering the highest quality care possible is crucial. When it comes to delivering quality care, these are the things that matter: real patient advocacy, good staffing levels, and local healthcare workers who are invested in our local community and the care we provide. Together, we stand ready to work with the future owners, and yes, the employees who dedicate themselves to working at Regional are going to need a strong voice too. Ultimately, we will be here to hold a new employer accountable to this community and the needs we have.
Thank you, Emma. Next, we'd like to hear from Joanna Rosenhein, who's a Consumer Engagement Manager with the Pennsylvania Health Access Network. Joanna?
Thank you. Can you hear me? Okay. Hi, everyone. As Aaron said, I'm Joanna Rosenhein. I'm the Consumer Engagement Manager with the Pennsylvania Health Access Network. And we're a statewide, patient-driven organization advocating for affordable and accessible health coverage for all Pennsylvanians. So as part of that, we operate an enrollment assistance program, and we help people all across the state apply for affordable health coverage, including here in Scranton. So I personally worked with a lot of people who live in this area, and I've helped them apply for coverage, and they rely on Regional Hospital, rely on the doctors at Regional, and we're here to help them make sure that they get access to the coverage that they need and can see the doctors that they need to see within Regional's network. So with that said, we're excited about the discussions that are in place for Regional to remain open, but we must ensure that any plans for an acquisition do not result in lost jobs, decreased quality of care, or the closure of critical services. We know that mergers and acquisitions are excellent predictors of full or partial closures, with 1 in 3 transactions leading to a closure and 90% of closures being preceded by a merger or acquisition. In the last 2 decades alone, 148 hospitals in Pennsylvania have been merged or acquired. 32 of those have been closed entirely, and 25 have eliminated life-saving services like emergency and maternity care. Far too often, we see hospitals make lofty promises about how mergers or acquisitions will lead to new investments in facilities, increased jobs, better care only for those promises to be broken. In 2017, when Lock Haven and Sunbury hospitals were acquired by UPMC, the president of UPMC, Susquehanna, made specific promises to reinvest millions in the hospitals and improve access to care. Just 2 years later, Sunbury Hospital permanently closed their doors, and in 2023, Lock Haven ended inpatient services. We cannot let this happen here at Regional Hospital, and regardless of who acquires the hospital, whether it's a nonprofit, an established nonprofit, or a corporate entity, we must ensure that our hospital remains open and that services aren't gutted. Regional Hospital is currently an affordable option for people seeking care here in Lackawanna County. We know that x-ray costs are 3 to 4 times lower at Regional, and some services are 7 to 9 times lower at Regional Hospital than the surrounding hospitals. We need to make sure that Regional remains a safety net for people who are uninsured or underinsured, and that costs don't skyrocket for hardworking families. In many cases, hospital mergers or acquisitions lead to increased costs for patients, loss of key services, and in some cases, closures. We must have a process in place to ensure that community needs are taken into account throughout this acquisition process. Just finally, we want to say that, last session, the PA General Assembly considered legislation that would put protections in place so that communities aren't left behind if hospitals are merged or acquired. It failed to pass last session, and And we just want to emphasize that Harrisburg must intervene to move this legislation forward to protect communities from hospital closures and reduce services to critical care. We're seeing it all across the state, and we need our members in Harrisburg to take action. So thank you.
Thanks, Joanna. And we're going to dig into a little bit of what Joanna talked about in just a minute, but we wanted to open it up to the state representatives. Welcome, State Representative Jim Haddock. Happy to have you. Just to react to sort of what you've heard from our panel this evening, if you have anything else you'd like to share.
Thank you. I think the only thing I would like to say is that hearing from all of you, whether it be ER access, union jobs, access to care, it's the same message over and over, and how important it is to keep these doors open. We know that the team we work with in Harrisburg knows that. I think, and even more importantly, the other two hospitals know that. They are watching this very closely because their patient load right now, as Emma said, is at maximum capacity. So they know they can't have more emergency room vehicles sitting outside in their parking area. We cannot transfer patients in critical need and emergency needs. We cannot transfer them down the turnpike to bigger hospitals in Philadelphia or Danville when their access to care is critical and emergent. And the community knows this. So I think these town halls are really important. The answers that you're looking for, we don't have right now, but we know that the solutions are being worked on. And when Representative Mullins, when he spoke about the facility assessment, this has been going on a long time. I mean, we had CHS executives come on up to Harrisburg in June of last year to say, hey, we got a problem. We know we have a problem. We would like to offer you a clean exit, and let's work together. That was we're pushing almost a year, but we had another buyer that fell through, right? We had to start from square one. We have these entities at the table now that are working with us, but when they get the real meat of the assessment 3 weeks ago, it's you want to bang your head against the wall and think, are you kidding me, just 3 weeks ago? But believe me, this is the progress that is going to make this solution faster for us. The answer for us is coming. I mean, CHS has been patient, but they're going to draw a line in the sand and say, we're out of here. They have been patient, and I will say that, because I know they haven't been good players in the medical world. I've seen what they've done to our hospital, and it's criminal. Believe me, I know that. And that's when we talked to, and our own governor in his address, the budget address, spoke about the for-profits in healthcare and how it's wrong, and we need to do something. It's being addressed, but at this particular time, CHS has stayed at the table, which is most important. They're at the table with the other hospital entities or whomever they may be working to get to a solution. So I think that's the main message for tonight.
Thank you. And I think all I would like to add to that is that, I think what my colleague, Representative Kyle Donahue, always says, and he says the assets of these places are the people. The assets are you. And if I'm in the shoes of a prospective buyer, an operator, I take tonight's energy and focus and turnout as a very promising sign, as an evaluated asset that is ready to hit the ground running under a new banner, under a new moniker out front. That yours is a workforce, a labor force that knows what they're doing and doesn't really care who's signing your paychecks. You just want to go back and have some security and reassurance that you're going to have that paycheck when you're doing your life's calling of just caring for people. So if I'm one of these healthcare systems, if I'm one of these hospital systems, I take a look at what you've already organized, you as SEIU have done, and I take it with some reassurance of the energy that you all just want to keep working. So I think it's I think it's a good thing, and I think the fact that we're looking forward, and I hope I've been able to impart, that we've been able to impart some level of hope and reassurance among you, is a takeaway from tonight. And I want to give just my colleagues, Representative Donahue's representative here, Sean O'Shea, and Representative Jim Haddock, an opportunity to respond and comment as well.
Hi, everybody. Like I said, my name is Sean O'Shea. I'm on staff at Representative Donahue's office. I recently just started in the position this past May. I retired after 22 years in the military, retired and took this position. And when I took it, I wasn't really sure what to expect, and I was finding my way. But I can tell you, and I can vouch for you, I've been in meetings in Harrisburg, I've been in meetings in Scranton, I've been on Zoom meetings. I can vouch and say that this team of legislators and state senators that are involved in this are working just as hard as they're saying they're working up here, and I can vouch for that personally. Representative Donahue does send his regards that he couldn't be here today, but Kyle takes this very seriously, and it's really near and dear to his heart at this time. And if I may, I'd like to share a personal story about my experience at Regional Hospital. And July 17th, 2007, 7/17/07, don't play those numbers, they don't work, I've been trying. My wife went into Regional Hospital. She was pregnant with our twin daughters, Madeline and Maggie, and she had to have an emergency C-section. My daughters were born a little over 2.5 months premature. When they pulled Maggie out, she wasn't breathing, and the team revived her. They were 2.5 pounds when they came out. They went down to under 2 pounds and had to stay in incubators for over 30 days. That was an extremely hard time for my wife and I. We also had 2 toddlers at home as well. So Amy Ryan was on the nursing staff that took care of my daughters. We didn't know if they were going to have health problems moving forward. We didn't know if they were going to have heart problems moving forward. But because of Amy Ryan and the team at Regional Hospital and that NICU, my daughters are thriving right now. They're 17-year-old seniors at Scranton High School, and they're both playing basketball at the collegiate level next year. So thank you so much for all the work that you did. Thank you.
Just this past week, a dear friend of mine, and I don't have permission to use her name, so I'm going to be a little vague on information. She's been a nurse her whole life, and she's formerly from the city of Scranton. She had a life event, and something changed. And I saw on Facebook, of all places, I got a new job. So I saw her the other night, and I said, where are you working? And she said, Regional Hospital. I looked, and my heart went up in my throat. And I said, you do realize the situation there? And she said, Jim, I'm a licensed nurse. It's what I do, and it's the town that I was born in. She said, I'll be okay if something happens. She said, my kids are grown, but it's my calling. And I looked at her and I said, well, on the inside, we're trying. And I'll tell you what I told her. You know, this hospital was for sale. It was going to close. They are a private business. We don't have a lot of say. We don't have a lot of regulation over this. But what Bridget and Kyle has said, we've weighed in heavy from the state level, almost to the point of unprecedented weigh-in. The good news is, well, unfortunately, the sale fell through. The hospital just didn't close because they were ready. So while it's not a lot of rock-solid information we can give you, you guys that survived, that was like my friend that just joined your staff, your dedication is unbelievable. it speaks volumes for the people of Northeast Pennsylvania. And, you know, they are negotiating with all the events and how ruthless corporate America is. If you could just think that comment through, and hopefully any day now, you know, because every day it just eats at you. But the negotiations are alive and well. I spoke to a member of the governor's staff today. There's several angles they're working on, and they're looking for information, and the talks are alive. So that's some good news. And it's not a rock solid, but the fact that they didn't just close the door, because over a year ago they said they're willing to just give the keys to anybody. And so there's some progress there. And, you know, this, while we're here in Scranton today and in Lackawanna County, just a few short months ago, my mother-in-law was in the Geisinger system in Plains. And the emergency room, and, you know, stuff's going on, and it's getting late, and she's getting tired, and my Amanda was ready to jump out the window. Why isn't my mother getting a room? And I said, we were at separate cars. I said, you go home, I'll handle this. Because I kind of knew. And I went out and I finally got to a nurse. And I said, mother-in-law isn't getting a room, is she? She's going to stay in the hall all night. And they said, yes, we have no available rooms currently, but we'll monitor as we are. And I said, well, I've had that conversation with her. She's okay with it. She's stabilized. So this problem isn't just unique to Lackawanna County. Right down the street, we're having the same issues. And the systems all know if this system was to close, the other hospitals in the area won't be able to handle the overload. So this is a for real issue, and you guys are front line. So I commend you for your staying. I get texts, I get instant messages, today's world, phone calls to the office, and I really wish it eats at my heart, and I know it, Bridget, and Kyle Mullins, and Kyle Donahue, and the governor. We wish we had real solid information, but because of the nature of the business and this being a private concern, these negotiations have to be held close to the breast. But we're trying as best we can. And we just want you to know that. Thank you.
Thank you, Representative. Thank you, Representative. So we're going to open up for questions in just a minute here, but first we wanted to talk through some important next steps together. I want to refer back to a moment for some things that Joanna was talking about. The reality is we are all living through healthcare horror stories right now. I just think that's real, what we're facing. And the same is true around consolidations and sales and mergers with hospital systems. Joanna talked about the experience at Sunbury, the experience at Lock Haven. Do folks remember Mercy Hospital? I mean, we've lived through it here, right? We lived through the closure of Tyler Memorial Hospital up in Tunkhannock, a First Hospital, right, over in, where's that, 44, right? Kingston, thank you. And the reality, though, is that across the state in Pennsylvania, there are also stories that aren't horrific when it comes to consolidations and sales. The reality is there are a few stories where a hospital sale or a merger has resulted in an improvement in care, in an investment in frontline staff, right, in respecting and expanding union rights and workers' rights, and most importantly, a responsiveness and an ability to hold accountable to patients and families, you know, the community in that area. And what we have seen across all of those stories is that the deciding factor on whether or not a sale is improving care for patients and moving workers and communities forward is the work we do before the ink is dry on the deal that is signed. That is why we're having this town hall tonight. What can we do now is the question, right, in front of us. And I'm hearing from our state representatives to have hope, and I want to be hopeful, but I'm also not going to wait. And we want to make sure that we are uniting a broad coalition of frontline healthcare workers, of unions in our area, of community organizations, of elected officials, of local businesses, of local families and community members, and saying to whoever the new employer is, hey, we welcome you to our community, and we look forward to working with you to ensuring the best possible care, that we respect our union contracts and our frontline workers, and that we have accountability to the community moving forward. Does that sound good to people in the room? Does that sound right? Are you with me? Are you ready to just wait and see what happens, or you want to get to work? Anybody want to get to work? Raise your hand.
Let's get to work.
All right, so here's the plan. Oh, sorry, go back, let me back a slide. So there's two things specifically we wanted to do with folks tonight. The first is we are launching an open letter. Ooh, can I get some help passing these out? We're launching an open letter to the new employer, the new owner, whoever that is. Do you mind just sort of passing those, and maybe some folks can help pass these out? And the idea here is that anyone can sign this. Organizations, we're going to start going to churches to sign this. All of you, we would ask to sign it. All of our elected leaders, we would ask to sign. And the idea is that way, whenever there is a new deal and that ink is dry, we can then take this to the new owner, right? A united front, and say to them, here's what we're looking forward to moving forward with together in this community. And the second thing is, we have, and do not leave today without yours, we have these window signs we would like to put up in your car, in your house, in your friend's local business, in the coffee shop. Like, please take these with you. Do not leave without taking a couple of these to pass out to folks. And you'll notice this doesn't say, hey, new owner, we expect X, Y, and Z, right? We are demanding X, Y, and Z. The tone on this, as well as the tone in the open letter, is specifically designed to actually be hopeful to Representative Kosierowski and Mullins' points. The tone on this is actually to be hopeful, because we don't want what we're doing in the community to mess up any of the deal making that is actually happening on the inside, right? We don't want to scare away any potential new owners here. We do want to welcome them to our community. But again, what we have seen time and time again, community after community, sale after sale, the communities that are in the strongest position to not only protect care, but improve care through a sale. Not only protect workers, but invest in frontline workers. And not only to just do what they want, but to actually be responsible and accountable to the community, depends on the work we do now. So I am honored and happy that you all are here to join us tonight, and excited to be launching this coalition together with you. And if you should be getting a sheet that's coming around. Sorry, next slide, please. That has this QR code. Again, this is our open letter to the new owner of Regional and Moses Taylor Hospitals. It lays out the importance of saving the hospital. It includes those sort of three things we're looking forward with you to working on together: improving and expanding care, preserving good union jobs, and addressing community concerns. You can scan this QR code. Again, it's coming around on a piece of paper as well. Next slide, please. And then we are also, next slide. Over the next 2 weeks, so not this Saturday, but the following Saturday and the Saturday after that, we would like to invite you all to join us to canvass the community. So we're actually going to meet back here, not in this room, but just outside, at noon on Saturday, March 22nd, Saturday, March 29th, to canvass the community. We'll be walking through town, signing people up on our open letter, and asking local businesses and churches and other organizations to actually put up these signs, right? Because again, the purpose here, what puts us in the strongest position possible to make sure that not only do we keep the doors open, but this hospital continues to be and even gets better at being the point of care for so many families in our community, really depends on our ability to build this coalition moving forward and unite people on the front end. And then when the new employer comes, sit down with them, meet with them, talk to them, and hold them accountable to make sure we're building the best possible community together. Make sense? All right, so before you leave, please make sure to sign the open letter. Please take extra window signs with you. And if you can, join us, again, not this Saturday, but the next 2 Saturdays coming up. You can sign up for that on the sheet. It's a mobilized link. You'll get an email reminder and all that sort of stuff. So we are very much looking forward to working with you to build this coalition, to keep the hospital open, and to improving the quality of care moving forward. And so, I know you've all been like holding your questions till the very end, so I think we are finally there. So, quick, off my mic. Do folks have any questions for the panel? Questions? There'll be a mic runner. Bob, I see you, but I think, do you have a question?
Yes, I do.
All right.
You considered the following. I'm listening to what you're saying up here now. Why do we need to go out in the streets to bring people in? Why is it whoever the assumed new owner may be here to tell us who the heck they are and what they're going to accomplish and what they're going to contribute and how much money they're going to put in and the modernization of the hospital, their status, how much money their CEO is going to get? Have you considered all this before you ask us to go marching up the streets and doing their job? Their job is to come here and tell us who the hell they are. Because we're the ones that are gonna fill their pockets with money when we have the health care. And that's the questions I like answered.
Yeah, great question. I think we should actually meet with the new owner, and they should come to us and tell us those things. I don't disagree. What we have seen, though, is the communities that have lost services, the communities that have lost jobs, the communities that have lost those things through that process are the ones where we didn't do this kind of work ahead of time. Like, this helps us in the long run.
Let me continue with that to consider. Why are we looking at anybody out there to buy our hospitals? I'm looking at all the panels here, all the money Harrisburg, Washington has that we're giving to illegals, foreign countries. Why are we funding them and not taking care of our own hospital, or merging, better yet, to take the medical college to take over the 2 hospitals, eliminate Geisinger from it and the control, and put our health care and the physicians we're training. That they now have
Interesting,
2 more
yeah.
hospitals to stay here and train and give us the medical care we need. Without a high-priced CEO or high-priced staff, we could get billions of dollars donated or given to us to modernize these hospitals, let the medical college operate.
The medical
them.
college needs a partnership with a hospital.
Exactly.
Medical college cannot survive. If I may remind you, our medical college was circling the drain before Geisinger stepped in and took over. So we need, the medical students being trained are very reliant on the hospital to be trained by those skilled physicians to do clinical hours. So a medical school cannot exist on its own island. It needs the hospital support, right? Believe me, we have spoken to lots of different entities. We've been doing this for a year, lots of different entities. Washington, D.C. is not going to come up to Scranton and buy our hospital. The federal government is not going to come up here and buy our hospital. It's not going to happen.
In fact, there's a majority in Washington threatening to cut our health care.
I hate to disagree with you. If
So-
it's the right way
Just saying.
to deal with Washington,
Yeah, appreciate your questions, Bob.
That's the whole budget
But-
world, and we had a nice town hall on Monday night about just addressing this, because it's very hard to speak in hypotheticals. We don't know what they're doing with the budget. I mean, you're talking about $880 billion over 10 years. They're going to have to go over the biggest pot, and the biggest pot is Health and Human Services, right? They have the most money. So we have to be very careful. I'm not saying that we should have reform. 100%, totally agree with that. We got to do something, because it's a monster budget, right? But we have to be careful, because when you think about Medicaid and you think it's going to illegals, you have to remember something. Guess who takes care of lots and lots of long-term care patients that are living their lives in long-term care? Because all the assets are taken away, right? Mom and dad are living in long-term care because they can't be taken care of by the sandwich generation, us, right? Because we're working, and if your mother or father or elderly loved one suffers from something like chronic disease, dementia, Alzheimer's, they can't live alone, it's dangerous. Guess who's supporting the bill? Medicaid. So we gotta be real careful when we start ripping apart Medicaid, Medicare, Social Security, CHIP, SNAP. We gotta be very, very careful.
And I'll also say something else, Mr. Bolus. And Mr. Bolus, there's something else. You want to talk about Washington? A few months ago, we were up here, and there was a congressman-elect that we invited up here, and I don't see anybody from his staff here neither. Washington's not our friend right now.
Other questions in the room?
The other two county commissioners are either.
Other questions in the room?
There's one here.
We have our, yeah.
Yep. See over here?
Oh, the other one's gone, I'm sorry. The other
I'd
one.
just like to point out for everybody, my name is Bob Sheard, the need to go out there and tell people about this. Over the years, this hospital has saved more lives. Meaning, I wonder, 33 years ago, I had triple bypass in regional. Dr. Zabi, everybody remembers. I'm here today because of that man and that hospital. And the treatment that I've had in that hospital is above none. They were the greatest people. I was very scared at 39 years old, having open heart surgery. And they were there for me. And a lot of people in this community feel the same way when they had their loved ones in there with a heart attack or whatever it was. We need to go on Facebook and call everybody we need, our friends, our family, and flood Facebook. And then get a number of these signs, put them in our windows, even get yard signs. We need to save this hospital because the community needs this hospital, and a lot of people will suffer without it. So I'd like to see everybody flood. That's what we need to do. Let the new owner know, and what then we need to do.
And to Mr. Bolus's point, it is not the responsibility of us to take care of this. I understand what you're saying. Why are we asking all these people in the room to go door to door and tell, where's the new owner? Well, I think, to your point, it's important to make sure people know that we are doing things, we are working, and it's important, and they have to remember how supportive we have to be about this hospital system and how important it is to keep these doors open.
My mother was an RN at the Mercy Hospital for most of her career. I come from a medical background. My cousin ran the emergency room at CMC. I'm a volunteer firefighter for many years in troop. I have EMT training because I've been credited with saving over 17 lives in our towing service, including that of 3 state troopers. And I've been given 3 medals by the American Towing Association. Nobody knows more about what it's going to take in this hospital to take care of our people in our community. Yeah. I don't want to see another Commonwealth group.
No for-profits in healthcare. I agree with you. Yes.
I would rather see us figure out how we, as a community, save our own hospital, get our own funding for it, and put our own people to run it. There's access out there if you look outside the box. And I've been all over the world. I've been in many places. This is our home. It's been my home my whole life. And I know from the medical background, we could sure hell do the job if we really reach outside and look at somebody, not another provider, to buy us out while they got their own issues with their own hospitals and staffing and problems. We need to take care of our own people right here. And they're the ones sitting behind me that go there every day, as you did, Bridge. As you did, you took care of the patients. That was your life. That's our life. That's why Bobby stood up.
Mm-hmm.
Yeah.
His life was here, and all of us have been through here. We don't need a buyer. We need a provider, and that's us. putting the money together.
We need a couple $1 million though, too.
Yeah, no, Bob, I certainly
You got a
appreciate.
provider with $150 million, tell him to call me.
I certainly appreciate the sentiment that, like, look, the reality is,
Another question.
nobody's going to come and save us in this community. I do think it has to be us mobilizing now and organizing now to make sure we provide the best care possible.
Save ourselves.
I saw one over here, and then I'm coming over here. Yes, sir. Yeah.
Do we have a projected timeline for when the public will be made available for the potential buyers, what foundations are involved or whatnot?
Go ahead.
I really hesitate to put a timeline to anything because that would be disingenuous and that would be speculative on my part. I don't have an answer. I've learned that in politics, you have a few choices when you're answering a question that you don't know. You can try to mix something up, or you can tell people the truth. I'm telling you the truth. It always works better. And I don't have that answer for you. But it is in the interest of the current owner and operator, as well as the workforce and a prospective operator, to do this sooner than later.
Does that necessarily mean, though, that, like, we're going to only find out who the prospective buyer is a day before the keys get handed over?
You know what? We're probably all going to find out at the same time. To be honest with you, they're being the players at the table and the negotiators. I feel like, and believe me, as soon as we know, we'll let you know, because I would love to be able to make that announcement. I was here in December, and I was being told, we're going to know by December 23rd, 24th. I sat in this room and said that because I was given that assurance. So as Representative Mullins says, it's really hard for us to do that. I do know there's a very heated, like very high level, it's moving fast, especially because of
not
COVID.
heated.
Heated, like, what do you mean? Like, it's moving faster now because of what
on the
happened with
front burner.
it really is. There's a lot of attention on us, so I'm hopeful that it's soon.
There was another question over here, and then I see one, and then in the back, right here.
Let me preface my questions with a comment. I applaud you all for the effort you're taking to make this issue have a positive resolution. I used to work at Moses Taylor. I was there when CHS bought, okay, that's some 10 years ago. I don't think Commonwealth Health's stockholders are going to delay forever and ever on this. If you say it's been going back since June, if you track their stock price over the last 10 years, that institution is in deep, deep financial doo-doo, very deep, okay? Yes. And every day goes by, their hole is getting bigger. And so, you know, if they want to be a going concern and not go out of business, they got to poop or get off the pot. I'll tell you that right now, okay?
Right.
What I would like to say, well, I don't want to have to come here for a third town hall meeting, okay?
Me either.
3 months
Same.
down the road.
Yeah, none of us do.
I understand.
Yeah.
But if I do have to come back, I would like to see a representative from Lehigh Valley and Geisinger to add their weight and their perspective so that everybody knows that you closed Moses Taylor and Regional, and they're in worse shape than ever, and we all suffer. So I would like to, if you have to do this a third time, please invite them to sit on a panel.
Good
I'm going to
idea.
bring you to the negotiation table. You know how to, I think you have your.
You would have this done yesterday.
Yeah, but you are right. You're right. To hear from Lehigh Valley and Geisinger, and I speak on their behalf, saying how they are watching this because of their nervousness about this potential closure.
Catastrophic.
Yes, I agree with you.
Absolutely.
I agree with you.
Catastrophic.
Yes.
People will die.
I agree with you.
Now, did CHS ever state, like, this is our drop dead date, if we have, okay, I'm telling you, the
You're-
stockholders are going to.
Yes, you are correct, and we're watching that.
I'm surprised that this has been going on since
I will say, as much as I'm disappointed in CHS over the last 10 years and what they've done, I will say they have been good. Their general counsel, I hate to tell them the lawyers are the good guys, but the general counsel has truly kept them at the table. The executives in Tennessee, yeah, if you've talked to them, yes, they probably want to say, get the hell out of Scranton now because of what's happening and because of the hemorrhaging of the monies. And that's going back to things like Medicaid and Medicare and the reimbursement that happens here in Lackawanna County. We're less than what happens in Luzerne. So yes, there's lots of issues there, but you are correct. CHS is not going to hang around here forever and keep the doors open and so you are right. There is a timeline, and to your point, there has to be a sale too, right? Fast. So I think that we're moving quicker to get that date.
I think we had one question over here, and then we're going to the back. Sorry.
So my name is Jackie. I'm a registered nurse, and I'm a member of People First Pennsylvania and the Nonviolent Medicaid Army. We are a politically independent organization made up of everyday people. We are healthcare workers, but all of us need healthcare. We have been fighting hospital closures in the state for the past at least 7 to 10 years. Such as Crozier and Sharon Hospital in Northwest Pennsylvania. CHS, like other private corporations, were allowed to siphon wealth and health from our communities and have been leaving the community devastated with a lack of adequate health care for some time. We watched and learned while CHS closed down hospitals such as Tyler Memorial in Tunkhannock, Hearst Hospital in Kingston, and Berwick Hospital down the line. We learned that we need to remove profit accumulation from the healthcare equation. We know that the Pennsylvania government is sitting on a surplus of monies that politicians just are sitting on. We know that this money can be used to purchase these hospitals and have the workers and other community members run the hospital for public good. Even not-for-profit entities must operate in a profit-driven environment with profit-driven principles. We know that the looming cuts to Medicaid, this hospital system in Scranton, and many others across the state will still be at risk of inadequate healthcare services in their neighborhoods. We also know that under the current system, healthcare costs are hemorrhaging. And it would be more cost-effective in the long run to have Medicaid for every Pennsylvania resident than continue on with the way things currently are, or with so-called reform that panders to political parties on either side instead of to the people. We are asking that everyday people on Medicaid or unfairly excluded from Medicaid join us in fighting to open up Medicaid to all Pennsylvania residents, either for free or to be purchased at a cost based on your income. Help heal each other and lead our communities to a state of wellness instead of disarray.
Thank you for sharing. I think we had a question, sorry, all the way in the back, and then we'll come to the woman in black. Sorry, did you have a question in the back?
Has there been an update about Wilkes-Barre being included with whatever is happening?
Yeah, good question. The CHS system in Wilkes-Barre is stable at the moment and being supported by CHS. The only hospital system on the sale is the regional campus up here in Scranton. But as for now, CHS Wilkes-Barre is stable.
Then we had a question, yeah, here in the black.
I only have one question. We've heard about nurses, we've heard about everything. What are we doing to incentivize physicians to stay within this area or to bring new ones in? In the paper the other day, I read another physician that had been a CHS physician that's now signed with Kaiser. So I see more and more leaving our two hospitals to move on. So is that in your plan also to incentivize physicians, specialties, to grow the hospital itself?
Yep.
Right now, we don't have enough to grow.
Yeah, certainly retention and recruitment is and I'm not going to blame CHS for everything. When you leave services, when they lose services such as orthopedics and ENT and urology, and I see my friend Dr. Priate back there, who's a huge supporter of this. He's not, when I talk about generational medical care and people that truly believe in Scranton, he's a huge example of it. His dad was a surgeon, in Scranton. Donald, correct me if I'm wrong, were you like an orderly at one point and worked your way? So, we have people like Dr. Priate who are here with us, sitting in this room with us, that really want these doors to remain open because he understands, but recruitment and retention is huge. But how are we going to recruit and retain neurosurgeons, orthopedics, oral surgeons, urologists when our hospital is not sustainable? And listen, I'm not going to say that you don't have to make a profit. How are we not going to how are hospitals expected not to make a profit to be able to pay, right? I understand, but it has to be balanced. We have a payroll. We have to keep the doors open. You have to pay the electric bill. You got to pay. So I understand, you know, and a lot of that comes from balancing of insurance carriers, right? You've got private insurance, you have Medicaid, you have Medicare. So it's something that we have to kind of delve deep into, but we need to make some sort of profit to be able to. Now, there are big piggies at the top that make way too much profit. I totally agree with that. But I think we have to make sure that we have some kind of ability to pay back into the hospital system, to make sure we have the MRI, the CT machine, the OR suites, the ICU suites that our patients can recover, and we've got to have that retention of the staff, because listen, as a nurse, and I know the surgeons in the room will agree, they can do the best work in that OR, but they turf their patient up to the ICU, and there's no nurses up there. This is not a good system, right? So it's a whole entire workforce that we need to support, because the bottom line is we have to take care of our patients. That's what we want. We want access to good health care. I do not want to have to send my family members down the turnpike to go to a specialist, right? We have specialists here, and we've always had it. We've had wonderful health care for years and years and years. We had 3 wonderful community hospitals where you knew where to go to get the best health care, and you felt safe, and you felt like a relief when you walked in those doors. And we don't have that right now, and we cannot let that happen.
Other questions?
You again?
Let me come back to you, Bob. Let me try to get others. Let me try to get other voices in, and then we can come back. Yeah.
So I just want to circle back to retention. My name's Steph. I work in the dietary. I'm one of the managers. I don't work anything, but I come in every day because
Thank you.
what I enjoy doing. What words of encouragement can you give us for all of us that are still in limbo until we hear something? The retention in our facilities is awful. It's a revolving door. And then with whatever comes on the horizon, people are leaving.
Yeah.
They're struggling currently.
And I should be amiss not to, it's the support staff. When I talk about the hospital, and you say that, you say doctors and nurses, it's dietary, it's transportation, it's the janitorial services, it's a whole village, right? So in terms of retention, I thank you for staying, first of all. Thank you for all of you in the room here that are staying within the hospital's doors. Thank you. But I think that, under the leadership of Aaron and SEIU and those that are going to really, I've heard the word a couple times, accountability. I think that new owner is going to have accountability to who they're going to support. And it's that, like Representative Donahue, it's that human need that they have to remember that we are protecting.
I think, and the only thing I would add is with stability, with some certainty that we hope we are on the heels of, that these systems who are at the table negotiating and getting a real honest look under the hood with the facility study and understanding all that it will take to bring these hospitals, these facilities up to a good standard, where you can provide a standard level of care. With that stability will come increased morale, and I believe the effect of more confidence in just the regional workforce. And by regional, I don't mean capital R, I mean just lowercase r, our Northeast PA region, more confidence in the healthcare workforce. Those who are still there, and those who may be, who may see this as a renewed opportunity to go back through the doors of Mercy and Moses Taylor, or whatever we call them next, and understand, with some nostalgia and some real belief in what they once were and what they could be again, with a new operator. So I believe there will be a natural effect of it. A natural effect of stability, of certainty, is increased morale and increased interest and attractiveness of the various departments that hospitals need to run.
Can I just offer a comment on the thought about retention? In our experience, retention is not as complicated as employers would like you to think, generally. There's really three things that lead to retention: better pay, better work conditions, and a voice on the job. And that's also why at hospitals where we have a union, retention actually is better, and that means patient outcomes at union hospitals are better. And that's because the frontline workers not only want to stay there and work and get to know people, but it's because they actually have a say in the conditions of their labor and their work. And that makes a huge difference. Like, when we talk about retention, I think about nurse agencies. At Regional or Moses, do you have agency nurses working alongside you, or does that dwindle down a bit? But I mean, in most of our hospitals, we have agency nurses working alongside sort of regular staff nurses, but those agency nurses make 3 times as much. And those agency contracts also have conditions. They have patient ratios. You can't have over this number you can't be floated, you can't have those things. And the reality is if hospitals can staff using agency nurses, they're just proving my point, I think, which is, you know what, if you paid nurses better and you gave them safe working conditions and you gave them a say in what their working conditions and the standards of care that they're providing are, absolutely they'll come and work for you. And so it's part of the reason why part of what we're fighting for here, what we want to maintain and continue, is the union contract at Regional. It's not just for those workers there, it's for everybody who works there, but it's also for all of us in the community, because the stronger the frontline staff are, from EVS all the way to RNs and physicians are, the more voice they have in the conditions at work, the better care that they actually provide, and the better it is for all of us. Other questions in the room? And I'm coming back to you, Bob. Other questions? I think we have maybe time for one more. I see one in the back, and then we'll wrap. And if people are able to sort of stay and have other questions or discussion, we'll obviously stay here and happy to discuss. But I think we have time for one more. I see in the back.
Yeah, not really a question, comment. I work at Geisinger CMC. I wanted to come and help support SEIU.
Welcome.
Take any more. I work in X-ray, so I see all the ER patients, right? They all come to see ventilate. I walked down the hallway today and saw at least 8 ambulance stretchers lined up in our back hallway with their staff, with their crew, because there's no place to put them. And if they came in by ambulance, they're critical enough that they need some place to be treated, and we just don't have the room. And, that's a big reason why we need to keep these hospitals open.
Yeah, absolutely.
For us too,
Yeah.
So
And we need to put that crew back out on the street. The crew should not be stabilizing patients in the ER.
I made a comment to when I go, I think there's more EMTs here than
Yes,
there are nurses
yes.
in the ER.
Mm-hmm.
Yeah.
Mm-hmm.
And again, to your point where we have travel techs for the first time in my career of 35 years. And I'm working side by side with travel techs, making triple what I make.
Yeah.
Mm-hmm.
Just that these people give us the wages and everything, and you will get the people to stay.
Yeah.
We
Yeah.
have a big turnover too.
Absolutely. Thank you. So thank you all for being here. Thank you to our panel and our elected representatives. I know some folks had to leave. Thank you all for being here. And I hope to see you in 2 weeks, next Saturday, back here for canvassing in the community. Thanks.
Back for canvassing.